Okay. Yate. My name is Michelle Morgan Flowers. I'm the Utilization Discharge Planner for the Ft.Defiance Indian Hospital. I've been a nurse for 25 years. Um, I'm supposed to introduce my mother's clan first. My family came into the country in the 1600s, and they're Acadian French. So my mom is from Louisiana. My father's family came in the 1600s also, and they're Welsh and English. So my husband also is a nurse at the Ft.Defiance Indian Health. 13 years at the hospital, 25 years as a nurse. My first couple of years at the hospital, I worked in the emergency room. I also worked for Johns Hopkins Research for the Prevnar vaccine. Worked pediatric clinic, pediatric ward, case management, and been in the utilization discharge planning for 2 years. I started tracking our patients at the hospital. I've seen an increased number of cancer patients. So what today, I get mostly of the questions I get is, where is Ft.Defiance? How did you get there? What does it look like? So today I want to kind of take you on a journey of my home on the reservation. We're going to review the cancer data and the successes. I met Barbara 3 years ago through Fred Hubbard, and it's kind of been a whirlwind since that time. We've done a few things for the hospital and the communities. We're located in 2 states, Arizona, the Apache and Navajo counties. We're also located in New Mexico, so the hospital is in 2 states. I live on the Arizona side. In New Mexico, there's McKinley County and San Juan counties, and we cover 2,583 square miles, and the elevation is 6,800 feet. So when I left Ft.Defiance last week, because I went to Daytona for the week before coming here, we had 4 feet of snow in my backyard. The population, we have 167 registered patients, and 42,000 of those are active users at the service unit. This is the picture of our hospital. We are Indian Health Service, so we are government, but we're also going tribal corporate on Monday. So we will no longer be Indian Health Service through the government. We will be our own corporation. This is our front view from our CEO's office. Yeah, there is a cow. This is our view from, we can hike. This is the service unit. We lay right down in the valley. There's 198 houses on the compound, and I walk to work, so it's about a quarter mile. I live on the back right side of the hospital area. So we can hike up behind the hospital, and there's ruins, and this is our view when we hike. The housing statistics, when we start looking, we have 63% of our patients lack phone services. We have 37 that do not have plumbing, 33 that don't have complete kitchen facilities. 23% of those patients speak only Navajo, and the unemployment rate is 65%. This is a view from Blue Canyon. This is where my babysitter, I have 2 children that are 11 and 7. They do speak some Navajo, and they do attend tribal ceremonies. So this is part of the Blue Canyon and the roads they have to travel. My babysitter had to travel 3 miles down dirt road to come babysit in the morning. And sometimes she would travel and walk if she didn't have a ride, or I would go up and get her. And this is the road from Blue Canyon. So this is what she travels to get to my house every day. This is her housing compound. This is a traditional hogan, the dirt facility. Right here. This is what they'll do ceremonies in, and this is what they live in. This is the traditional hogan here. This is a sheep corral. This is where my family, my kids would go out sheep herding every day, and they call my kids the sheep herders. And this is our traditional bathroom. You can see it's air conditioned. Here. So, I mean, when you look at our patients as far as facilities, just getting sick and going to the bathroom every day, or getting up in the middle of the night and being sick and having to use an outhouse. This is the things that we are facing on the reservation. This is the playground. This is my daughter here. And this is her friend, and this is her Navajo sister, Laisha. At Fort Defiance, the service unit, the leading cause of diagnosis in 2009 for cancer was breast, prostate, stomach, and cervical, and kidney. In my registry, I track all the patients that come through across my desk, so I don't see all of the patients at the facility, but I try to track those patients, and I have 553 cancer patients, and 137 of those that are dead. We began networking in 2008 with Barbara and Fred and Bedora. And this is our accomplishments with all of the facilities and the networks. We had our first cancer conference on October 11th in 2008, and then July 18th. And then our third cancer conference will be in June the 5th. This is a picture at the Navajo Museum. This is where we host our cancer conference. You'll notice we have a cow right down here. And you also have the cattle bars here. So we come in here, and then the museum is in the back here. This is our veterans and our commissioned officers lining up for the cancer conference. We are very active with our military. And this is one of our gentlemen likes to do explosives. So this is the cannon firing when we do our prayer in the morning. These are some of our traditional children that were dressed up for dances. And this is the drum, the beating of the drums. It gets kind of noisy in the museum. Barbara says it's kind of like a circus when they come to the reservation. This is Barbara and Jack with Tony Mendez, who's a PBR professional bull rider. We networked with him, and he came to the facility and signed autographs, and we had a lot of the women lining up to get his autograph. Yeah, I did too. And this is Tony with the children that were dancing. This is Victor, the Leukemia and Lymphoma Society. This is some of our networking. This is Mary Dokes and some of our women from the Dene Breast Cancer group. Mary Dokes works with the Coleman. We did just get our second Coleman grant. This is one of our gentlemen who's doing the modeling calendars. This is kind of dark, but this is Nan and Charlie Kelly. If you'll notice, she's on the GAC host, the Great American Country host, in Nashville, and her husband. They're both cancer survivors, and they cut us a DVD and sent it to Fort Defiance. We were asking for them to come to the conference, so they cut us a DVD, and you'll see those on the YouTube videos. If you do Fort Defiance and do a search, you'll get to see their message that they gave us. This is our honor rider, the bikers. We also host a biking rally. And this is John Wayne and our bikers. This is the joke was John Wayne, they sponsored our cancer conference, and they've done it for the past 3 years. And I begged them for a big cutout of John Wayne. So John Wayne travels around the reservation, and that's the joke. We take him to the parties, and we dress him up sometimes. No. The Susan G. Komen grant, we organized the Dene Breast Cancer Awareness and Training Program, and it's called Women Helping Women. This is some of our women that you'll see. And we do involve the children. My kids are involved, and Mary